Okay, so lovely people, I want to say a wonderful good morning to you, good afternoon to you, and good evening to you, depending on what time you are watching this video. As always, my name is Atorowe Peter Wedam, and I am a lead presenter at Wedambu TV. Now, yesterday, Wednesday, 24th April 2024, I watched this very touchy and very sorrowful interview on TV3's New Day episode when this lovely lady that goes by the name Mary A. Fordwor was interviewed regarding her throat cancer ailment. I must confess to you that I was really touched. I almost cried for her. I felt her situation, and I never wish such an illness for anyone, not even my avowed enemy. Now, watching the interview and watching Madam Mary regarding what she has to go through, I could literally feel her pains. This woman has had to undergo 14 different surgeries to correct the cancer in her throat region. Now, if you watch this interview, ladies and gentlemen, you will appreciate your own situation regardless of what kind of illness or sickness you are going through right now in life. Take a look at this interview. Madam Mary A. Fordwor, a throat cancer patient and a throat cancer survivor for that matter, as she recounted what she had to go through to survive her predicament. She did this interview alongside one of the doctors that worked on her. By courtesy of TV3, I present you this interview.
Mary, so after surgery, the very first one, how many surgeries have you had so far?
14.
What did you say?
14.
14?
Yes.
14 surgeries?
Yes. I was supposed to go for another one in January. This January, but thanks be to God, I've been favored.
Amen. But why 14? Is that the treatment?
Well, we had challenges with her along the line.
Okay.
And I mean, if you had seen her some 1 year or 2 years ago, you won't say this is her. So she came, the first one, we took the biopsy. We had the first major surgery for her. And we were trying to conserve her voice, so we took parts of the voice box, not everything.
Okay.
But unfortunately, that didn't help, so we had to go back and take the whole thing out. Then along the line, she developed certain complications. She couldn't eat through here, so we had to send her and put a tube direct. So as she's sitting here, she has a tube that is directly to her stomach, which she feeds through.
Okay.
And then we had to send her several times to try and open her throat so that she can eat through her mouth, even though she was eating through her tube. You would like to taste your banquet.
Yes, of course.
You would like to taste. So she couldn't eat through her mouth for about a year.
So hold on. Describe to us how, in what form was the food? If it was now going through the tube, was it liquid?
Liquid.
So describe to me, what was it? Soups with fish, blended. Describe it to us.
Blended. Everything, but I was preparing mine with bones, cow bones.
With bones.
So that you ate me getting some calcium. Everything blended, fruits, everything.
Okay. At what point did she need this device, and what is it even called?
Okay, so she has what we call the voice prosthesis. After we take out your voice box, you can use it anytime after 6 weeks. We put it there to help in your speech. She got it after about 6 weeks, and we put it there. But we had to deal with the complications.
6 weeks after the first surgery?
That was the third surgery, right?
Okay.
Yeah. So we put that there. But what she has around it is like her artificial nose. It's her artificial, because as she's sitting here currently...
she's not breathing through her nose?
No. She's not breathing through her nose.
Wow.
So she's breathing
through her neck. So she's breathing through her neck?
Yes, please.
So where is the breath going out or coming in from? The white patch, the white substance, or the bigger, rounder patch?
So she has an opening in there, so she can open it. Oh. So this, you see what we call her trachea, and that leads you directly into her lungs. So that is where...
So I see a tube in there.
So the tube that is going behind there That is the small one. That is the voice prosthesis.
Okay.
That is the voice prosthesis.
Wow.
Yes.
And this device, must it be sanitized? Must it be cleaned? Must it be changed? Tell me how it operates. What do you do?
I clean it morning and evening.
You clean it yourself,
Yeah.
morning and evening.
That's me to God, I'm a health worker.
So you know exactly what to do.
Knowledge. And that is what is keeping me
Okay.
safe.
But we do train people who are
We
not
can
health
train
workers. So
also.
all our patients who have this, we train them. They see the speech and language therapists. They go through sessions with them on how to care for these devices.
So I call myself a neck briefer.
Okay.
And I have this band on my hand
Right.
indicating that anytime I collapse anywhere, you can't put oxygen on my nose.
It won't work.
Yeah. So oxygen must be given through my neck.
Okay. So that's why you have this
Ah,
band.
this band.
So this band must be on you 24 hours a day. You cannot
If your
take
mind
it
is
off.
on there, it's there.
Okay.
Don't take it off.
If we can zoom in, because this is some public education, I would have never ever known that this even meant anything. No, keep it on your wrist. I'm sure we'll zoom in to see it. So anytime you see, what's written on the band?
Neck briefer.
Neck breather. That's what's written on it.
There, stomach.
Oh, so God forbid, just in case she collapses anywhere, you cannot do the normal resuscitation. You would have to do it through here. But I'm sure it would take a clinical person to do it, because the layman would not be able to administer anything to her.
Yeah.
I see. How long did you say you've had this condition?
26 was today's date.
Today's 24th.
Tomorrow to 3 years.
Tomorrow.
tomorrow
No, after surgery. After the 14th surgery.
What you said.
Yay! I love your spirit.
Yeah.
Congratulations on your survival. But tell me, in talking, is it stressful for you when you're talking?
I think sometimes it depends. You can't talk and eat at the same time.
Okay.
And you can't talk and breathe at the same time.
Hey, this is stressful.
So
You
I
wait.
stress.
You can't talk and eat at the same time, and you can't talk and breathe at the same time. So you have to choose which is important at any
the
particular
time.
point in time.
So I try to talk. As I'm talking, I'm not breathing.
Oh.
I release to take in air.
Okay.
That's why I call it entrusted life
Change.
change.
Wow.
Take risks to be in the States.
Right.
So I'm more concerned of them broadcasting because I don't want people to get to my stage. You may not succeed.
Right.
And even if you succeed, depression can kill you.
I know.
So you don't want people to get to the stage. And detection save lives.
Okay, so when you started talking, there's this faint sound that is coming out now. Is it because you're talking faster, you're talking a lot more? Oh, so it means I have to be lenient on you when we're having conversations. We would have to speak one at a time. So that's here on the screen right now. Okay.
Of course, I ask you humbly to subscribe to our channel, Wedambu TV, so that you will always be among the first to get the alert when we upload our next broadcast. Meanwhile, you can search TV3 New Day, dated 24th April 2024, to watch the full course of Madam Mary A. Fordwor's interview on New Day regarding her throat cancer predicament and the operations she had to go through to survive it, plus what she has to do on a daily basis to keep her throat assisted apparatus clean and hygienic for her use. Peace.